Hey everyone, welcome back to another Fab FAQ Friday. I don't think I need an introduction anymore. I'm Karly Edwards for HD Dental Coaching. I am loving life today. It is sunny, it is beautiful in Kelowna, BC today, and I am here with the lovely LeeAnn Shipowicz.
Hello all.
Just feeds my soul to be here. I absolutely love it.
I know, it's so nice. We have this good energy thing,
Yeah.
which is good. It's called synergy when you work with somebody. Yes.
So just to recap, we are on our last part of our 3-part hygiene series. Number 1 question was, how do I know if I have a perio program?
Check.
Question 2 is, how do I put my patients into a perio program? And now I have question number 3. And since LeeAnn has the dental hygiene background, we are asking her the 3rd question.
Okay, I'm ready.
So the question is, should my hygienist be flossing and doing prophy on every patient? What is the standard of care?
Oh, that's a really good question, Karly. We do get asked this a lot because in a hygiene team, you have different hygienists and we all come with our different background, but it's very key to be consistent from each hygienist. So when you exit, the patients are getting a similar experience. So that said, flossing, which is the easy answer, flossing should be done on a regular when the patient comes in. So if there's somebody's coming in for perio recalls with it, which what I mean is if they come back to back, let's say they have over a month, they come every week to get into health. That's different. But I'm talking about at their recall appointment, they must be flossed. Because here's the thing, many, a good chunk of probably 80% of the population do not floss at home. Plus, they also don't know how to floss. So it's important to show that they pull the floss around the tooth, go down into the side there so that they can not damage the space in between the teeth. Because if you don't show them and you assume, there's lots of damage they can do. Like, you know what I mean? So it's just bad. It's nobody's friend. So to show them takes a second. So show and do quickly every patient that sits in your chair on the recall is very important. Mm-hmm. And you don't have to beat it to death. You know, some people aren't flossers. That's okay. You can get them into a different system and so that they can still stay healthy with not having all that gunk and infection in between their teeth. So there's that. Mm-hmm. Now, the prophy question, that is a challenge. So I would say, yes, for the most part, you should be doing a prophy on your patients. Now, here's the thing. You are going to have some patients who don't like it and not necessarily do they all, quotes, need it. But again, it's the one time within 3-6 months that they're sitting in your chair that you have the opportunity to remove all the plaque. Now, here's the thing. If they say, I can't stand the grit, you can say, hey, no problem, Mrs. Patient. I am happy to use some delicious tasting toothpaste as I prophy all your whole mouth. So you can be creative, but to have the opportunity to remove all their plaque with the prophy every time they sit in your chair for the recall is key. Again, like I said, every patient leaving with a similar experience. Mm-hmm. There will be an exception to the rule, but the rule is let's have 95% of the people do it. Unless they're the challenging ones who say, I hate it.
I don't know who would hate it. I love getting a prophy.
I'm kind of a bad patient sometimes.
There we go.
And see, here's the truth. I tell them, just do the outsides because I can't stand the grit. So I understand, but I also am easily influenced. So if my hygienist says, hey, no problem, I will use the gritty stuff to get the stain removal from all that red wine you drank. And then on the inside, I'll use this toothpaste just so I can remove all the plaque for you so that you're at a zero baseline. You know, that makes sense. So of course I'm going to comply and so will everybody else.
There you go.
How's that for the
That
answer?
Was great. That was really great. Thank you so much, LeeAnn.
You're welcome, my sweet Karly.
Awesome. So thank you everyone for tuning in to another Fab FAQ.
Yes, another Fab FAQ.
I love that hygiene series. I'm going to have to, we're going to have to put out an assisting series. So
that's good.
Any assistants, any dentists out there who have assisting questions, I would love to answer those for you. Reach out to us, Facebook, email, LinkedIn, telephone. We would love to hear from you. And as always, have a great weekend, I guess. Sorry.
Yeah,
and we'll see you guys next week.
Bye.
Bye.